and welcome to Facebook Live from Dartmouth-Hitchcock. I'm Joanne Conroy, the CEO and President of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, and I'm here today with a very good friend of mine, Karen Fisher, who is the Chief Public Policy Officer for the Association of American Medical Colleges in Washington, D.C. She is here for a visit to give the health policy lecture that's sponsored by Wayne Granquist tomorrow. But she's also here visiting the campus and learning a little bit about Dartmouth-Hitchcock. Karen actually spent almost a decade at the AAMC as Senior Director in Healthcare Affairs. And that's where I met Karen when I went to the AAMC in 2008. She left and went to serve as Senior Health Counsel for the Senate Finance Committee for 4 years. And she has a real commitment to public service, and that is like public service with a capital P, and worked very diligently with that committee for the next 4 years, but then came back to the AAMC in 2016, where she is now the Chief Public Policy Officer. So thank you for joining us, Karen.
Great, glad to be here.
So I wanted to talk to Karen and interview her on Facebook Live because of your career path. You know, when I went to Washington, number one, I was impressed by how many young, really bright people there were that went to Washington just to get a taste of public policy. And it is the place for people to learn about policy. So how did you get into policy?
Well, that's a good question. My background is a little bit different than a lot of people's background. I actually went to pharmacy school first at the University of Pittsburgh. My father was an independent pharmacist, and I really loved what he did. But I was really bitten by the policy bug because at the University of Pittsburgh, they're an academic medical center, and I sort of saw the interactions between the education and the clinical settings. And I had some good mentors there who said, well, if you're interested in policy, you should go to law school. And why not go to law school and stay here at the University of Pittsburgh, which I did, and so I got a law degree at the University of Pittsburgh. I then moved to Washington wanting to do policy, never wanting to go to Congress or spend time in Congress, but I wanted to sort of be outside of that space. But I ended up working for a healthcare commission that advised Congress on healthcare policies, predominantly the Medicare program policies. And after that, as you mentioned, I then moved to the AAMC, which represents all of the major teaching hospitals and all of the medical schools in the country, and focused on the health policy issues that affect academic medical centers, and found that very interesting. And then had a chance to work with you and spend time and really get to see from an operational standpoint about representing and working someone who works in an academic medical center. And it was during that time that the Affordable Care Act passed. And it was also during that time that Medicare and Medicaid were also going under financial challenges. And I feel very strongly about healthcare and the role of the federal government in healthcare, and found an opportunity to go and work at the Senate Finance Committee. I sort of hate the name of the committee because it doesn't really have the word health in it. But the Senate Finance Committee for the Senate is the committee that does all of the legislation for Medicare, the Medicaid program, as well as the Affordable Care Act. It also, interestingly, does the tax legislation, which is why it's the Finance Committee in that arena. But had, as you mentioned, that opportunity to spend time and actually work with a lot of great people and work on some important issues during that period that I was there, 2011 to 2016.
So what advice would you have for a young person? The Dartmouth Institute here actually trains a lot of graduates that are really interested in health policy. So what should they think about when they graduate from a program like that? Like, what next steps should they take? I think we do get a lot of people that come to Washington, and I'm not sure they're always fulfilled in what they end up doing, even though it's an exciting place to be. What recommendations would you have for young students that want to get into health policy?
Well, I think Washington's a good place to come. And I think sometimes people see a lot of partisanship, but there's a lot of bipartisanship that also occurs when you're actually in Washington, in the federal government. But there's a lot of places besides being in the Senate or working for the Senate, working for the House of Representatives. There's healthcare commissions. There's an agency called the Government Accountability Office that does a lot of reports for Congress. They are a nonpartisan entity. There are the agencies themselves that run the programs programs. For example, the Centers for Medicare and Medicaid Services that operate the Medicare program and work with states on the Medicaid program. So there's a lot of opportunities beyond just saying, well, I want to be a staffer in the Senate or a staffer in the House. And I do think some young policy people come and think that's where they need to be. And you can learn a lot at these agencies about how programs work, and then you can still have the opportunity to work on the legislative side if you want. And I found that some of the people who came from agencies and then came to the legislative branch brought a lot of great experience with them to that legislative side rather than coming cold from that front. But I'm a big encourager of people coming to Washington. I think healthcare and healthcare policy is only going to get more important. So we want good and bright people, Joanne, coming to Washington. So please come and bring your talents to there, because the American people and the government needs it.
You know, it's interesting. I think the first time I had kind of real insight in terms of how legislation was crafted was maybe building up to the Affordable Care Act, but there was some legislation that was floating around. And I remember a feeling that it was very poorly written, and realizing that a lot of young staffers actually are told to kind of craft the framework of it. But then they send it to agencies like the AAMC and a lot of other stakeholders, where we kind of hammer it into some semblance of kind of a working legislation that may actually result in working regulations.
Yes, I would say that often they will reach out to stakeholders and say, look, this legislation is going to impact you. Tell us what you think will work and what won't work. But they also work very closely, again, with those agencies who will implement the legislation. And those agencies have staff who are very adept at reading legislation and saying, hey, we're going to have trouble operationalizing what you want us to do, Congress. And there will be a give and take, a back and forth, where they say, well, what is possible for you to do? I also have to give kudos to the legislative councils for both the House and the Senate. There are experts there who write and finalize legislation, so that if a staffer, and particularly their boss, the senator or representative, says, I have an idea, this is where I'd like to go forward with, they will go to that legislative staff person, and they will put it in that fine-tuned way of making sure it works within the statute. And then again, the offices have to work with the agencies to say, if this legislation would pass, can you actually put regulations to operationalize it? And then they talk to, as you mentioned, the stakeholders like the AAMC and say, how will this legislation impact you? Will it help? What problems do you see? What unintended consequences do you see? Because the ultimate goal is to have a piece of legislation that passes and the president signs that is workable and that will make a difference and won't have unintended consequences. Because as I think a lot of people have seen, it's hard enough for Congress to pass legislation. It's even more difficult if they made a technical mistake and want to go back and clean that up and pass another piece of legislation. So you like to get it as right as you can the first time.
So how long have you lived in Washington?
I have lived in Washington for a long time, Joanne. I will say more than 20 years, and maybe we leave it at that.
So do you ever still just kind of get impressed when you drive around or walk around the city? It is an incredibly impressive city. And when you live there, you appreciate just the almost grandeur of the place.
You know, it's interesting you say that. I do feel that way. When I left the Senate, you know, and everybody who leaves the Senate, you get a badge, like you have a badge here at Dartmouth-Hitchcock, and we had a badge that allowed us to walk freely and go into the Capitol itself and go into the rotunda, and I was able to walk freely around wherever I wanted to go. And when I left, I had to give up that badge, and it's a little bit emotional because to be able to walk in and at night, there's a lot of working that I did a lot of work in the Capitol offices themselves. And at night, when you left and turned back and looked and saw the grandeur of the Capitol building itself, it is momentous, and you see the history of all that has occurred there. It's a very old building, and they take very good care of it. But you do I think it's important in Washington, given everything that goes on, that you have to stop every now and then and say, a lot of important things have happened here, and a lot of more important things will happen here, and you're just a sort of a step along the chain.
Yeah. So I'm just going to break to remind our audience that I'm here with Karen Fisher, who's Chief Public Policy Officer at the AAMC. And if you have any questions, just go on our feed and submit the questions, and we have people monitoring that, and they'll hand them to us. You know, I have to say, of the number of times I went in the White House, I think the first time I went in, I was impressed by a couple things. Number one, the incredible efficiency of the security. Of course, we hope they're efficient, but it was actually very seamless. You know, 48 hours ahead of time, though, you go through a complete FBI check, I'm sure. But the second thing was when we had a meeting in the West Wing, it was kind of cool, I have to say. It looked like I could turn my head around the corner and see Martin Sheen walking down walking down the hall with his, you know, group of aides. But you know, what is that feeling? I know you've been in the White House a number of times when you do that.
I think it is a great feeling, and you know, it's even beyond the White House itself. There's two very large buildings that are connected to the White House, the old executive office building and the new executive office building, that have staff that do a lot of work in those places. And I would say, just being on the Hill, I was so impressed with the amount of work that people did. And regardless of what party you belong to or who was in the administration, the people who worked there were very dedicated, and what they had in mind was improving the country, in our space, improving health care for people. The ways of which they wanted to improve health care may have differed in that front, but there was a real commitment to making a difference. And as you mentioned, for many of these people, particularly as they get older, it is a sacrifice because you don't make a lot of money in that space. And to see how many hours a week people work for that limited amount of money, the commitment they have because they feel that what they're doing is helping to make the country better. And I felt that way about representatives and senators. I always feel badly that we talk when Congress recesses. It sounds like, you know, like your school, you're recessing. Right. But they really go back to their districts and to their states, and their schedules are very full back at home, meeting with constituents, doing town halls, going to visit places like Dartmouth-Hitchcock, and your senators and representatives do that here. And they really are quite hardworking as well. And I feel sometimes like they aren't given enough credit for the hard work that they put in, generally 24/7. You know, they can go home in an airport, and there's generally a constituent who's coming up and asking them something or questions in that arena. And I do think it would be nice to step back and that we should acknowledge all that work that comes in, recognizing that we still have differences sometimes about how the country should move forward.
Yeah, you know, you're right. I remember taking some flights to Portland, Maine, and seeing Olympia Snow working on her kind of homework as she was flying home for the weekend. We do have a question from the audience. How important is it for today's medical students to understand the current health policy environment?
I think it's really important to understand. Thank you for that question. I think, you know, there's so much to learn when you're a medical student, and you're so focused on just getting it right. And you, Joanne, being a physician yourself, know that feeling of when you were in medical school and just wanting to do the job right of doing diagnoses and doing the right treatments and care. But healthcare has gotten so complicated, and how it moves forward. I think having the physician's voice as we move forward and see how should the healthcare change. And physicians and nurses and other healthcare providers often are on the ground floor and can see what's working and what's not, and what can make a difference. And I think we're seeing that in some cases, and Dartmouth has been the lead in this, in looking at different models of how we provide care, more team-based care, and understanding that. And I found when I was in Washington, whenever physicians came and healthcare leaders and CEOs came, those were extremely valuable discussions, not only for me, but for the senators I worked for, to say, this is what we need out in the hinterlands. You know how to do the policy, but this is what we're seeing on the front lines. This is what our patients need in that front. And so I think it's critical that the medical profession stay involved to a certain point. And I think staying involved in your professional societies as you move throughout your career is a good way to be able to stay involved and understand healthcare policy.
You know, it's interesting. I remember when we were kind of debating the ACGME 80-hour work week assessment, and there was a comment that it didn't land very well always for the legislative staffers because they often worked far more than 80 hours a week when they're staffing somebody during really difficult times. And I think when you were on Senate Finance, if they were actually debating something, the entire office was there, wasn't it?
It was there. And you know, the 80-hour work week is an interesting example of sometimes how Washington can work with the community. In a sense, there were so many issues, and you know them better than I do, of how long residents were on duty, over 100 hours in some cases. And there was a lot of discussion, a lot of science at that time that said that was too much, and there were problems with handoffs. And legislators started to get involved, in policymakers, and said, we're not sure this is a good way to educate, we're not sure this is a good way to do patient care, and basically came to the stakeholder communities like the AAMC and others and said, if you folks don't do something on your own, we're going to legislate something. And I think that brought the community together and got principles, and it was difficult because all of the specialties have different views on that and they have different requirements. But it did bring the community together to say, who is better to determine how to make this work and how to limit the hours? Us or policymakers in Washington? And while I just lauded the skills and the talents of policymakers and staffs in Washington, there's a limit of what their knowledge base is.
Yep.
And so to the extent in that example, the community did come together and the ACGME changed its requirements so that there wasn't a need for congressional action. And oftentimes that's as important as doing legislation as to when not to do legislation.
Yeah.
And that was a good example you raised.
Yeah. So if we're going to talk to the average employee about why they need to kind of keep their ear to the ground on what's going on in Washington. You know, we serve a rural community. We are an academic medical center, have a lot of research, have a lot of education. What are the things that people need to just be aware of? Because they could affect our ability to actually deliver those services up here.
Yeah, I think, I think for one point, the last 2 years, I think lots of the country got educated more in healthcare policy and healthcare by virtue of the debate over the Affordable Care Act, repeal and replace legislation, whether it was the number of uninsured, whether it was the role of Medicaid, whether it was the role of healthcare and insurance with people with pre-existing conditions. So in a sense, it's building on that momentum. But, you know, what is it, 10,000 people are turning 65 every year and going on to the Medicare program, which is a very successful program for beneficiaries. And so as that program has changes that could occur to it, people need to be aware of that, either for themselves or for their parents or their grandparents going forward. And I think we're making more progress in the rural space with regards to telehealth and opportunities to have more arrangements so that an academic medical center like Dartmouth can reach further out into the rural areas. I know that your organization has been very involved in a project that the AAMC has helped shepherd. It's the coordinating optimal referrals experience to leverage electronic health records and allow specialists to do consults out in the more rural areas with telehealth. And I see that type of activity only increasing over time. The research that's going to be occurring in the next 10 years, we've already seen so much research. And so, you know, all of it really starts at academic medical centers, and then there's a role for the pharmaceutical companies down the line. But so much of that research starts, and what we have been seeing over the last 5 to 10 years, and it's only going to increase exponentially in the future, is the advances that we're seeing in research. And so I think there's a lot of excitement in healthcare. It is costly. And that's a concern as the country moves forward on fiscal issues. But I think we all have a responsibility to pay attention to it because it affects each one of us. This is an issue that affects each one of us personally and individually.
So we do have another question from the audience. As we all get older and more people join AARP crowd, every single Sunday newspaper that comes to my house now has an AARP card application. That means more people on Medicare. Can the federal government handle it? And what does this mean for the future of medicine?
I sort of led into that question before it came. I think it's an issue as we have more people, particularly for this baby boomer population. It will recede for those people who were born after like 1960, 1961. But I think it's a real issue about the Medicare program and the rising cost of healthcare generally. And what do we do about that? The Medicare program is financed through payroll taxes, and there is an issue about how long that can continue. And I think that's why places both at Dartmouth-Hitchcock and across the country are looking at other ways to deliver care that promote efficiency while retaining high quality care. And I think over the last 5 years, we've seen more institutions and even insurance companies, et cetera, looking for those opportunities. And I think that's what we're going to have to do, because the alternative is, do you start looking at the benefit packages and saying, well, we can't afford to provide this level of benefits. And I think people in your position, your colleagues across the country, feel very strongly that we should be able to provide those benefits. Let's do it in a way that's cost effective while maintaining high quality, so we don't get into a position where we're limiting making decisions, financial decisions that impact patients directly.
Yeah. So we're getting close to our 30 minutes. Have you ever thought about running for public office?
No. No.
That was a really quick answer.
Okay. I wonder if you've ever thought about doing that. No, I really like what I do. I like doing policy. To be honest, I'm a little bit nerdy. I don't like to tell people at cocktail parties, but I like getting into the weeds a little bit about how do you actually do it. When you look at the Medicare program, for example, it is a federal program, but yet it impacts every individual in this country, yet our country is so diverse. So whether it's the rural areas of New Hampshire or the very urban areas of Boston, to the South, to geographic areas, to the complexity of patients, and yet you want to figure out a payment system that will ensure we're providing high quality care in all of those areas for all of those patients, and it gets a little tricky to do in that front, and I find that very interesting and challenging, and so I sort of enjoy what I do.
Yeah. It actually is an incredibly fascinating program that has pretty low administrative costs. People don't appreciate it. It's like 1.8%.
Yes, it's very low administrative costs.
Which is amazing that they can administer a program to so many people at such a low cost. One more question.
Okay.
Vermont's approach to health policy is very different than New Hampshire. That's actually true. Since we actually straddle both states, it's kind of a tale of two cities. We are the tale of two states because we are so close. Can you talk about the states' roles in healthcare and what national trends you're seeing? And just Vermont has One Care Vermont.
Right. And so I'll be brief because I know we're running close on time. I tend to spend most of my time on the federal level. The states tend to have a much more prominent role in Medicaid and have been doing a lot of exciting things in the Medicaid programs in terms of ensuring good care on that front. There are opportunities at the federal government for states to get waivers to be able to experiment more. And the federal government is allowing states to experiment more on their health care. There was an innovation center that was legislated as part of the Affordable Care Act that allowed for more innovation. So I do think there is this issue of allowing states to work with their local areas and work with their local communities to what healthcare is best for them, while recognizing that states also have fiscal burdens as they try to deal with their own budgets in that front. So I think having a balance of ensuring that across this country we're ensuring that everyone's getting high quality, good care, while recognizing that individual states may have different ways about wanting to do it is a good balance.
Yeah. Do you think we have identified one state that might be on the road to doing it right?
It doesn't mean that they aren't. I just think there's still a lot of variation, and I think people are still trying to figure this out. And for good or bad, the Affordable Care Act added in a new dimension to this and added in a new role as to what role the states play and the federal government play, what role insurers play and providers. And I think we're still trying to figure that out. And the pace of innovation also is happening so quickly. I think in fairness to payers and to states and even the federal government, trying to figure out to make sure that we continue to support that innovation while at the same time having some stability for the system is still always a balance for everyone.
All right, good. Well, great. Thank you, Karen. And
Thank
thank
you,
you,
Joanne.
everybody, for listening to our Facebook Live. And have a wonderful week.